and welcome to Keep Talking, a community dialogue about mental health. My name is Maxwell, and I'm the manager of the continuing education program at the Brattleboro Retreat. The Brattleboro Retreat is 184 years old, and it's an addictions and mental health facility located in southeastern Vermont. It serves adults, adolescents, and children in a variety of inpatient and outpatient settings and residential care. The Brattleboro Retreat provides care and courage when being human hurts. Today, in our interview, we are going to be discussing sleep and insomnia. And the reason for this is that I'm very excited that we have a presenter coming to Brattleboro on September 21st, that's a Friday, and presenting to mental health clinicians from all over New England about treating insomnia. And that expert is Colleen E. Carney. Welcome, Colleen. I'm so glad you could join us. Colleen is coming today from Toronto, coming to us via Skype from Toronto, Canada. And I'm thrilled that you were able to make the time to do this.
Thanks for having me.
Well, I'm really excited that you're here. Colleen is the director of, or Dr. Carney, I should say, is the associate professor in the psychology department at Ryerson University, which is also in Toronto. She's also the director at that same university of the Sleep and Depression Laboratory. You're considered one of the leading experts in the treatment of insomnia. You've written a ton of articles and also several books, including your co-authorship with Rachel Mamber, a PhD, and the books that you co-authored with her are Quiet Your Mind and Get to Sleep, and also Good Night Mind, which sounds appropriate for my mind, which seems to, I have one of those racing minds. Dr. Carney, the Institute of Medicine says that 30 million Americans have insomnia, and the Center for Disease Control says that 80 million Americans are sleep deprived, and we know that doesn't happen in Canada at all, because because all things good are in Canada. But you are going to help us Americans work this out. So why should we worry about whether we've had a good night's sleep or not?
You know what? I'm gonna start right off and say you shouldn't worry. That's really what insomnia is, right? So it's normal for us to have a poor night here and there, but it really is, what are we going to do afterwards? And I think people get really nervous that it's going to continue and become chronic. Mm-hmm. And in that anxiety, we can really start a habit that sets up chronic insomnia. So should we worry about not getting enough sleep chronically? That sort of depends. It's interesting, what really is problematic is when people don't prioritize sleep, meaning that they don't set enough time each night in order to sleep. They're sleeping at a time that's completely inappropriate given their internal clock. Or if somebody has an undiagnosed sleep disorder other than insomnia, these are all worrisome conditions because they lead to something called sleepiness. And sleepiness means that you fall asleep involuntarily during the day, which can be dangerous.
Just sleepiness.
Is not like that. Yeah.
You're saying sleepiness is yeah. Okay.
It's dangerous. And people think that insomnia is characterized by sleepiness. It really isn't, because sleepiness is a propensity to fall asleep quickly and sort of involuntarily. That's not what insomnia is. In fact, they wish that they could fall asleep readily and quickly. So with insomnia, something very different happens. Our body kicks in to compensate for the sleep loss in a very different way, and all our systems become upregulated and we become hyper-aroused. And that itself becomes a maintaining factor for the chronic insomnia. So it's almost like we have all these sleep conditions that we need to worry about. Then we have insomnia, which worry is a big component of it. And so we're trying to get people not to worry about insomnia because insomnia is really a disorder of preoccupation. So it's almost like you have to talk about them in two different ways.
Mm-hmm. So how much sleep do adults need? And why is it so important for overall health?
Right. So I can't give you a good number because it's individual and it's based on what you're doing at the time. So adult needs usually vary between 6 to 9 hours, right? And so we're always told it's 8 hours, but that's a bit of a myth. because there are some people for whom I could prescribe getting 8 hours and it wouldn't be enough. And there's some people for whom I could prescribe 8 hours and they would develop insomnia, always trying, striving to get the 8 and not getting it because they're actually a lower sleeper than that. So how you can determine what you actually need is what does your body produce on a regular night-to-night basis and what makes you feel good. So you really want to look, say, 2 weeks at a time and calculate the average and whether or not overall over those 2 weeks you felt good. And that's going to give you about what your sleep need is at the time. If you're falling below that, you should experience something called sleepiness. That is this kind of nodding off, dozing off, lots of effort to stay awake during the day, unsuccessfully. And that's telling you actually have a greater sleep need. But feeling tired during the day, which is different than nodding off, that's not a good indicator about getting too little or too much sleep. That's more of an indicator of sleep quality.
Mm-hmm. I see. Yeah, go on.
Sorry, the second part of your question was, why is it important for health? Well, good sleep is important because it's important for learning and for memory. It's also a point at which your brain actually flushes out a buildup of amyloid. And without that, then we think that people could develop cognitive disorders.
Wait a minute. What was that $10 word, amyloid?
Yeah, so we've known for a long time that with things like dementia, there's a buildup of amyloid, and it creates plaques and tangles. And something that happens while you're sleeping is that all gets flushed through the brain and dispersed. And that's actually an important thing that happens while you sleep. There's learning and memory. So memories get consolidated, but unimportant information gets pruned away. That's important too. And growth hormone, which is important for regulating pain, for growing, and for restoring tissues. These are all parts of sleep. There's probably many other functions to sleep, but we don't actually know that much about what we know about that. But if people are not getting enough sleep, then they're going to be vulnerable to a variety of disorders.
So how much about sleep is actually in our conscious control?
You know what? In some ways, I like to sort of rebel against the idea of control when it comes to sleep, because I think insomnia is really a disorder of believing that sleep is supposed to be effortful, right? You're supposed to like get blackout blinds and kick your spouse out of the bed and drink a certain tea and do all these sorts of rituals in order to get the right sleep. And that actually to me is a recipe for insomnia. Sleep is supposed to be effortless. So what you really want to do is you want to focus on what you do have control over, which are the habits that set up the sleep system. Being active, awake, and out of bed a significant amount of time during the day. And so activity is important, regularity is important, and a wind down is important. All the things that we know to do for a little kid,
yes,
that's what we need. We don't outgrow it.
Wow. So do people in the healthcare professions, do they define insomnia as a disease? Do they define it as a disorder? And even those words sound kind of awful. So is that a disservice too?
Well, you know, I like to think about, when I think about a disorder, I think about something that is happening in a specific way chronically and is causing problems for that person. And approaches like cognitive behavior therapy, for example, are really designed to help people manage that condition, whether we want to call it a disorder or not. And the things that originally cause insomnia are often not even there any longer. And it's the things that we do secondary to having poor sleep that actually then need to be removed in order for the condition to go away. So I'm not sure whether I would call it a disease, a disorder, or condition or whatever, but sleeplessness is part of the human condition. Even insomnia is, but chronic insomnia is not, and it really causes a lot of problems and leaves people vulnerable to actually mental health disorders. So that's something we can readily fix.
What have they tried? Are there common things that people try before they get to you?
Yeah, I mean, so we know from research that many people start with the over-the-counter and supplements. That's where we're going to start, and the internet, right? Now, on the internet, there's a lot of misinformation. So I would say one of the common things for insomnia is to try melatonin. And melatonin is not an insomnia aid. So, and we know a lot of people are taking it. So we know there's a lot of misinformation out there. We know that sleep hygiene is on the internet. It's the most well-disseminated treatment on the internet. That's actually a treatment that doesn't work for chronic insomnia. So that's something that is out there, and people are trying, and they're frustrated.
That's interesting because, you know, I think I told you that my own doctor asked me about my sleep hygiene, and I was, I found it's a little off-putting. I thought, you know, is she asking me if I take a bath before I go to sleep? And what is sleep hygiene?
Well, yeah, it is a strange term, isn't it? It's sort of whether or not your habits are clean.
It sounds like a nanny talking, you know, a really strict nanny.
Yeah, and that's, the problem is that it's well-meaning, and with good sleep health, it's not like they're really out there. It's just, it's not going to help you with insomnia. So it's things like making sure your environment is suitable for sleeping. So do you have a quiet, not well-lit environment? Well, people with insomnia are not poor problem solvers. You know, they know to fix their environment if something's up. They know to get rid of noise if that's what's going on. It's about, well, you should exercise, but maybe not close to bed. But the thing is that there's some evidence that says exercising before bed would actually be helpful, and some that it would not be helpful. So we don't really know what we're saying. Get rid of substances, caffeine, alcohol, marijuana, smoking. While it's true that all can be sleep interfering, when people go through withdrawal and they stop using it, especially if they're using it for something that it's effective for. So if somebody is using marijuana to decrease their arousal right before bed, and then you take the marijuana away without a replacement, then they're actually going to sleep worse. So this so-called sleep hygiene would actually worsen. Smoking cessation, that makes sleep worse. So it's well-meaning, but it doesn't work. And it leaves people very frustrated. And I think it does leave a sort of a bad taste in people's mouths when they go for help and they get a list of sleep hygiene tips, or they find it on the internet and it doesn't work. And that's the best that a doctor can do. When really CBT is very, it's easily accessible. You know, there are a number of books out there. You can get it on the internet. There's apps for it.
Tell us a little bit about CBT, or cognitive behavioral therapy, because that's what you practice and you'll be teaching on the 21st.
Yeah, so cognitive behavior therapy, as all cognitive behavior therapies are, they research what maintains a disorder, and then they test strategies to see if it's effective. And then they continue to test and refine until they get the best result. And cognitive behavior therapy, as it applies to insomnia, is really looking at, okay, what do we know about the sleep regulatory system? We know that the clock needs to be given proper cues and regular cues. We know that you need to build a drive for deep sleep, and in order to do that, you're going to have to be awake and active a certain amount during the day. And we know that we need to wind down before bed, and that if there's periods of wakefulness in bed, then over time, your body can associate the bed with wakefulness. So we know we need to disassociate the two. So those are the main strategies in insomnia. They're all based on how can we analyze what you're doing, learn together what you're doing, and make some slight changes to harness your sleep system so that you'll sleep better.
Is that what building sleep drive is? It's harnessing the system?
Yeah, so we have a system that makes up for lost sleep. So it's not like a bank. It's daily. And it's essentially done by, think of it like you have to blow up a balloon. Right, so from the moment you're awake and active and out of bed, your cells are working, it produces a chemical, and that chemical builds up in your brain. And you want enough of that chemical by the time that you're going to go to sleep, so that your balloon is so big and full and taut that when you get into bed, it's going to release the balloon, and that's going to be associated with a lot of deep sleep in that first cycle or two. And that's what you want. That's where all the restoration is. And the problem is people with insomnia feel exhausted. So they tend to cut down on activities during the day just by virtue of being so exhausted. And then on top of that, they may use a strategy. They may try to control it. And they'll say, I'll sleep in a little bit past my alarm. Even if they're not sleeping, I'll lay in. I'll go to bed a little earlier. I'll attempt to nap. And all of these things have a negative impact. It all sends a message to that system not to compensate. And that's not what you want. You want your body to compensate. So because it's counterintuitive, that's why, people worry, oh, is it my fault I have insomnia? Absolutely not. It's nobody's fault that they have insomnia, but there's secrets in your body to leverage the system so that you can get rid of it.
I've heard that people oftentimes their self-esteem gets affected because I can't get to sleep. Why can't I get to sleep? Other people seem to get to sleep. So do people come to you and they're kind of in a state of not trusting themselves very much?
Yeah, I think, I think it was actually a workshop that I did for you a year or two ago. Somebody said, if you put it in a positive light, like sort of a positive psychology light, what is the goal of CBT? And I said, the goal of CBT for insomnia is really to build back up your confidence as a sleeper. If I could do one thing for you, it's to learn together that your body's got this, and that all we have to do is do some little tweaks here and there to leverage your system, and then you're going to be able to watch on a diary your body respond in a predictable way. And when you can, and you see that, your confidence will come back, because you can imagine how anxiety-provoking it is to feel like you've really lost your ability to sleep properly. It really does take a toll on people's confidence, and they tend to feel like something's pretty wrong with them.
Mm-hmm. If someone has insomnia, and I'm speaking in a community, a pretty rural community here in Vermont, Boston's 2 hours away, how do people find someone a practitioner like you, who knows about sleep disorders?
Yeah, so there's a number of resources that are available. Certainly there are books, and you'd want to look for something that has cognitive behavior therapy, because that's the number one recommended treatment for sleep disorders. A couple of resources. One would be the American Academy of Sleep Medicine. If you go to that website, you'll find a provider list, and it will show you providers who are boarded in sleep medicine. I think that's very important. In a rural area, there always is going to be a drive to a major medical center. And there is some in the Northeast, certainly, but there is a drive to one if you need a specialist. That's another option, too, is to look at the Society for Behavioral Sleep Medicine, which are people like me who are specialists in sleep medicine, but on the behavioral side. So they treat things like insomnia. They may help you with your narcolepsy and so on, or to help you to wear your mask for sleep apnea. And there's a list there as well. If you are not close to one of those people and it's not an option to go to a major sleep center, there's plenty of evidence that people that are not sleep specialists can deliver this treatment very credibly. And this is why I do workshops, because my passion is creating availability for people. When you talk about 30 million people, they don't all need to see me. We know that most people can see a good mental health professional. It's a very brief treatment. It's an easy treatment. And so it's just a matter of finding somebody you have a good relationship who knows this treatment. And so that's another option. There's also internet therapy. There's a number of good ones on the internet, cognitive behavior therapy provided. And again, there's the books as well. So I think there's multiple sources for people now. When things are really intractable and really complicated, then we have to kind of move up the pyramid closer to a sleep specialist, and those two websites that I gave you are going to be your best bet.
Are there lifestyle factors that do contribute to deflating your balloon that people should be aware of? I mean, you talked about building up your balloon. I'm just thinking about the things that might deflate it.
Deflate it.
Yes.
Well, certainly inactivity does, right? And so when somebody says that they are active, if they're only active in slight spurts, and there's a whole lot of sedentary behavior in between, then that's something that unfortunately doesn't quite seem to build up enough of that chemical that we need. Certainly, excessive amounts of caffeine would. Small amounts, probably not a big deal, like 1 or 2 cups, probably not a big deal, but it does block that chemical that we want to build up. So like large amounts of caffeine, absolutely. Those are the main ones. And it sounds simple, but if you can imagine how tired people with insomnia are, that staying active and getting out of bed at a regular time and early for them, it might be a simple treatment, but it's not a simple feat. So I think having the support of somebody, particularly a good therapist who can troubleshoot with you to strategies to help you get up, things like using light, scheduling something pleasant, maybe something social. These are some things that we really need to kind of get moving, because it's an easy thing to say get up, but it's harder to follow it.
You said something earlier about cues from the clock. I think that was the phrase you used. And we haven't talked about the sort of inner clock that, I've always, since I was a young child, felt like I had some kind of relationship to the clock. And I don't know what comes first. It's sort of, what comes first, the awareness of that clock or something that's going on inside. And I know for myself, I wake up at 5 o'clock every morning. It doesn't seem to matter what I do. I wake up at 5. So and I call it my inner alarm clock. Is that something that needs adjustment sometimes with sleep?
Yeah, and so ideally, we want somebody like you. We want a body that says, this is the optimal time for me to wake up. Now, that may not match your preference, meaning that emotionally you might say, oh, I wish I could sleep till 7. But so one of the things we might work with is saying, okay, so physiologically you really are a 5 o'clock person. So can we shift things around a little bit so that you would get greater enjoyment of getting up at 5? If that's not the case and you really want to try and sleep in, then we would have to manage your environment by not having very little light exposure upon getting up. And you would actually have to also stay up a little bit later as well. So we would attempt to shift the clock a little bit for you. But people are highly variable in their ability to shift the clock. So it's much better, again, it's ideal the way that you worded that you have an awareness of your clock, that your clock is regular. That actually is an optimal clock. An optimal clock, you tend to get sleepy around the same time. You tend to wake up at the same time. You tend to get hungry at the same time, and so on. And your alertness throughout the day is predictable, and so on. That is the optimal. And that's one of the things that we teach people, is to learn what their clock really is and to act in accordance with it. That's actually how we get improved mood. It's something we want for depression. We get improved mood, improved alertness, and improved sleep. So it's very, very important.
So I've also read that in my research for this, for talking to you today, that the bed should become only associated with either sleep or sex. Now that sounds pretty good, but I'm just wondering, does that mean I can't take a book to bed with me before I go to sleep?
That's tricky. So remember I said that insomnia seems to be the exception to almost every rule. If you're somebody that has chronic insomnia currently, it's not a great idea for you to be doing anything wakeful in bed, because it can train you to become awake. And by the way, the whole sex thing, I think that depends on the person. I think that became, well, I'm not going to share my opinion on that, but I'm suspicious about where that came from. But I think that what we want to do is we want to protect that time if you have insomnia currently. I'm somebody who watches television before I go to bed. My colleagues read in bed. If you don't have a sleeping problem, and this is part of your wind down, it just as easily can become associated with relaxation and actually help you to fall asleep more quickly. So it's not an all or none thing, but if you have insomnia, one of the major problems is that people with insomnia get into bed and they're wide awake like a switch just went off. And if that describes you, no, there should not be a bed. There should not be a book in bed. There should not be any tablets. There should be any TVs. There shouldn't be anything on while you're in bed. Do all that before, get sleepy, and then move to the bedroom, just to make sure that the bed is only associated with sleep.
I see. How about pets? Do you allow pets in the bedroom?
Yeah, I want people to be relaxed about sleep. So the thing is that while it's true that pets are disruptive to sleep, pets are also something that people feel emotionally good at, and they like the company and so on. So I want people to sleep to live, but I don't want them to live to sleep. You know what I mean? I don't want them to be overly focused on controlling their environment. If it's the dog that's routinely waking you up, I think most people with insomnia are good problem solvers, and they'll say, okay, I guess we're going to have to find another little place for Rover to sleep because he's waking me up. But just having him in there and like disrupting your sleep to a mild extent, as long as you don't have chronic insomnia, you're going to take that little bit of sleep disturbance in stride, and it's going to be okay.
Are there symptoms that people should go, I mean, because you just said one about, if you get in the bed and you immediately feel like you can't get to sleep, is that a symptom of insomnia?
Yeah, so that's not part of, so there's symptoms of insomnia, and then there's what we would call diagnostic criteria, and that's for the disorder itself. And I guess that has implications for insurance and so on. But if you want to know what chronic insomnia really is, it's a difficulty falling asleep and or staying asleep. It could be one, the other, or both. And for many people, it's both. How long? I can't really tell you that because there's not really a good number, but it's generally more than 30 minutes, right? So we should be able to fall asleep within 30 minutes. If it's taking longer than that, on most nights, and this has been going on for 3 months or more, and it's causing you a problem, that's when we become concerned about it and we say, I think that a bout of CBT would be a good idea for you.
Wow. So what do you tell friends and family? And, I can imagine that this could be an issue with work. I mean, employers. What should employers know about insomnia?
Well, I mean, I think that employers already know because there's absenteeism, right? And there's leaving work. We know that insomnia costs a lot of money. We know that insomnia costs people a lot of suffering. We know that it's an independent predictor of suicide. This is a really important disorder for the problems that it causes. So I think employers know about it. I don't know what else to say other than that because I don't encourage people to call in sick for work because work it gives you a place to have to go to build up your balloon, and the regularity isn't disruptive. So when people call in sick, that avoidance of going to work actually has a series of negative effects that people are very surprised about. You're probably going to get less deep sleep that subsequent night because it's supposed to be your recovery night, but you're going to be laying around that day, not as opposed to being at work. You're losing that regular going outside, that light exposure, the meal at that time, and so on. You're throwing all that off the clock. And then there's the confidence. I can't cope with a day of sleep disruption. This is one of the sort of many digs at your confidence, at your ability to be able to feel like you can function after a poor night. The thing is that we can function. There's many times we've stayed up all night long for something fun, and we're like, oh, wow, I can't believe that I don't feel wrecked the next day, or that we have this really bad night's sleep and we're surprised at how good we feel the next day. We're like, oh, that's weird that we would, like, why don't I feel worse? Or we have a really great sleep and then we feel really bad. It's because there's not a one-to-one relationship. So I think I really would encourage people to focus on getting treatment rather than focusing in on attempting to avoid activities as a result of feeling badly.
That's great advice. And I'm so impressed with how positive and hopeful you are about this condition and what people can do about it, because it sounds like they're just very concrete, doable things to take care of it. And that I love your message that, every person has the tools already to get a good night's sleep. So that's a wonderful message to impart to our audience. But we're going to need to wrap up because I'm running into our time limit. But I am so thrilled that you were willing to do this via Skype with me, and I look forward to seeing you on September 21st. You'll be at the Brattleboro Retreat doing your program for mental health professionals. So this is a plug to those mental health professionals too, to get to your training, because they could be in a position to help a lot more people out there who suffer from this. So, yeah. Absolutely.
I just want to put one more plug in that, is that this is so important to do in people with chronic pain and depression and anxiety. in trauma. And I think that people think, oh, then it becomes too complicated. I'm so passionate about saying it's not. This is something that we can do. And so there's reason to be hopeful. And we know that helping the insomnia is going to help the other disorder as well. And so we
so
really
many
owe
other
it
things
to our clients, to be able to import this treatment for these people.
Wonderful. Thank you so much, Dr. Carney. I'm really thrilled that you joined us, and I'll see you on September 21st.
Yes,
Look forward to it.
my pleasure.
All right. Thank you so much for joining us here on Keep Talking. I want to thank the BCTV staff. They're incredible. Actually, we have our new our producer, whose name is Brian, and I'm blanking on his last name, but I'm thrilled that he's here and so helpful to us. And I look forward to another interview with you sometime very soon. Thank you.